Good morning. Thank you for joining this channel. Streaming from Long Beach, California. Today I'll talk to you about something personal. Folks, we all make mistakes in life. You go back and rectify. Most of the time we don't realize when we make the mistakes till we see what happens. I'll show you my personal story. I'll explain to my personal story. I've been a runner. I've been running for the last 30 years, 6 miles every day, taking care of myself, following the diet. I'm a healthy nut. I take care of myself. So I thought I was doing great. Oh, I don't need to buy health insurance. No, I did have health insurance but people when they say, oh, I don't need health insurance, I'm doing great, they're wrong. I'll show you. I'll tell you why. One day I was on a treadmill for an hour or two. I started having a little discomfort. Then I said, I was 62 at that age. Yes, I was 62. I said, this is not right. So I asked my son, who is a cardiologist. He said, Dad, it's easy. Instead of doing a CT angio, we'll just go ahead and put a dye and see what it is. I said, I sounded simple. I said, let's go for it. I went ahead and had it done. And they found a little blockage. They took care of the blockage. And everything turned out great. Everything turned out great. Doctors were great. Hospital services are fabulous. While having a procedure, there are, I would say, the overall service was perfect. And I was sent home within 23 hours. It was almost like a 23-hour stay in the hospital. So I went home. I was, then the surprising thing is, 10 days later, I received a bill. That changed my life, man. That did change my life. I received a bill. Being a doctor, I know what the services are supposed to cost. When I got the bill, it shocked me. I could have had a heart attack. It did shock me. It was $227,000, folks. I'm not kidding. The entire procedure should have been less than $20,000, but no. Even the Medicare paid $35,000, and my supplemental paid another 20, 30, whatever. They made about $60,000. The actual procedure cost shouldn't have been more than $15,000 to $20,000. That literally made me think, me being a doctor, the least I can do is find a solution. I kept looking. I came across a book called Unlocking the Secrets of Health Insurance Premiums. Health Insurance Premiums. I read that book over and over again. I spoke to Ron Bachman, the author. I was amazed the amount of information I got because he has been an actuarial for 50 years. He's the one who introduced the Medicare supplemental. I listened to his podcast, Healthcare Insights. He's amazing. So he has come up with a solution for Medicare, so Medicare supplemental. And then I started to have my own podcast and broadcast myself, streaming live, and became a public speaker because I really want to help. This has become my passion, folks. I'm passionate about healthcare. I believe this country is heading in the wrong direction because when I received that bill, I didn't know about it. They billed my insurance without my knowledge. I didn't have to sign any papers, nothing. And the insurance companies have been scammed. Basically, they've been scammed. And insurance companies, you know what they do? Oh, whatever the Medicare approves, they pay 20% more. Private insurance carriers. That's what I'm talking about. Medicare goes by, I don't know how they come out with the numbers, but in any case, I figured out there has to be a solution. Instead of insurers controlling the healthcare, as Ron Bachman has said, consumers need to be empowered. Consumers have to be empowered to lower the cost. And it came up with several domains: healthcare Amazon, Dollar Care, Google MD Live, Microsoft MD Live, Instagram MD Live, Facebook MD Live. I got all the domains. I have a non-profit organization called Foremost Organization. I renamed it as Dollar Care Organization, or I prefer Healthcare Amazon, because look at the Amazon. We won't have Amazon without a consumer. Yes, I believe time has come for consumers to take charge. Not only take charge, lower your health insurance premium, buying a deductible health plan. If you're healthy, believe me folks, if you're healthy, you have no medical issues, you don't see a doctor, if you're a 40-year-old, your premium should not be more than $100. If you're paying more than $100, there's something wrong, folks. I'm not kidding. Even when you're a 60-year-old, if you're healthy, you don't see any healthcare professional, it shouldn't be more than $100 with a deductible health plan, of course. Whatever you can afford, you can have $1,000, $2,000, $3,000, whatever the deductible. Yes, lower your premium, save money, put money into your pocket by opening a health savings account. So when you go to the Dollar Care org, go to the service section, fill up the health savings account, set up your health savings account. Whatever money you're saving by lowering your premium, put it into the HSA, which is tied to the Ameritrade. Yes, Ameritrade brokerage account. And you can buy some good index funds, leave a couple of thousand in the HSA bank. You can invest, you can diversify, and that money grows. Man, oh man. Even if you're a single individual, you're contributing $3,600. It can, in 10 years, that can be double. Yes. If you're a family, you're contributing $7,200 every year. In 10 years, $72,000. It can be double if you invest in the index funds like NASDAQ index, Vanguard index. Don't buy individual stocks because it's risky. So this is the way to go, man. This is the way to go. You come out ahead having health savings account, which is better than IRA. It has a triple tax benefit, folks. Contributions are tax deductible, appreciation is tax free, and withdrawals is tax free. This is a triple tax benefit. None of the retirement accounts you can have that benefit. Having a health savings account is a lifesaver, man. I contributed health savings account in 2004. I don't know why I did it, but luckily I did it. I do have a health savings. I encourage all of you to have a health savings account, which is not only benefits you and your family. And obviously when we have the funds, we don't want to spend money from our funds. Believe me, folks, consumers are very picky. They want to shop around. They want the best price for every service. When you don't use those funds, you can give it to your kids and grandkids. That's the way to go. Follow me, folks. This is Consumer's Doctor, Dr. Vengala. I've been passionate on a daily basis. I broadcast, I videotape, and also stream live whenever the opportunity comes. I want to educate the self-employed. A lot of people self-employed, they think they are wasting money. They're wrong. and small businesses, small business under 50 employees. I want to talk to the employers and employees alike. They can come out ahead. Employers come out ahead, employees come out ahead. And the larger employer groups, they're already self-employed, they're self-insured. So larger employer groups already have this deductible health plans with health savings. My main focus is to the self-employed, self individuals who are impaired, economically impaired, physically impaired, and for people, for small businesses. Thank you for listening, and I encourage you to follow me and subscribe, share, make some comment, folks. Goodbye. Salute.